Thanks, Merily. Okay, good. Thanks. All right. Remember, just as we talked about in the very beginning of this training, asking about suicide and talking with a person directly does not put the idea in their head. That idea is already there or it is not. All you are doing is simply checking in with the person and giving them an invitation to express themselves to you, okay? It's an important distinction. And oftentimes what people tell us is that they're actually a sense of relief. Somebody noticed, you know? And they may not express it in that way, but later sometimes they will tell us, I was so glad somebody finally asked me. You know, somebody was really listening. And so that's what this part is about. So we've looked at direct and indirect language that we may be seeing in behaviors or in language from the people that we're talking with. But what about our indirect language when it comes to now asking the question and having that interaction that can feel really awkward sometimes? We're not comfortable talking to people in this way in our society often. And so this is a chance for you through this training to look at what would be authentic for you. How would you talk to somebody? And how would you ask them this important question about their very life? And so there are different ways to do that, and we will invite you to be able to practice that amongst yourselves. Right now, we're going to talk about indirect. So as you can see, my partner Merily is quite direct, right? She'll just come right out to that person and say, are you thinking of taking your life? Okay. Have you thought about suicide? And those are some of the ways that we can ask, do you think you want to kill yourself? See, if we don't mince words, then they might not mince words. It gives them the freedom, like I said, to express themselves and to talk about what's really going on. Now, you may be more direct, okay? Indirect, sorry. Sometimes when people are as sad as you are, they may actually think about ending their own life. Are you in that place now? So that's a more indirect approach, right? So we will invite you to have the opportunity to try on some of this language and see what feels right to you, because again, just as Merily already talked about, the time to figure this out is not in the crisis, right? The time to figure it out is when there is no crisis and there's not somebody sitting there and a life is actually hanging in the balance. So we owe it to ourselves and to the people that we know and love in our communities to take this time to really think about how I would ask the question, what feels right to me, okay? And I know as a counselor in my training, we didn't even get that opportunity, honestly. And so that's something I had to learn, you know, as I became a clinician and became out in the field and, you know, started to interact with folks. And so you really do have to take it upon yourself to do this. Okay, it's important when we're looking at how we talk with people indirectly or directly about suicide to have an opportunity to practice. When we have more time in the training, we like to kind of stop and invite people to work with a partner to kind of informally work this out. Like I said, it's very important to have the opportunity to verbalize and practice these types of interactions because they can be uncomfortable and they can be difficult. And we want to get comfortable talking and thinking and asking about suicide. And so I would like to offer right now the opportunity for us, is there anyone here who can give an example of how they've asked somebody that they've worked with or that they've known if they are suicidal? Is somebody here?
Something indirect that I would say would be, I noticed you're feeling really sad. What have you thought about doing about that?
Absolutely, that's a great answer. Thank you. Yes, good example. Okay, this table.
I would ask, have you thought about suicide?
Yes, absolutely, great. And that looks so authentic on you, and that's what we want. We want to really check in with ourselves and see what's going to make this a natural conversation where the person can feel comfortable and we can put them at ease with our direct communication. Great job. Okay, we'll move on then into talking about our body language and what that says. You hear people talk about communication isn't always verbal, right? A lot of times it's nonverbal. And so the way that we kind of position ourselves and hold our bodies when we're having these conversations is important to cue into, right? And so someone can feel comfortable or uncomfortable really just based on how we're looking as we're having these conversations that are difficult. So if I'm standing there like this, you know, talking to you, you're not thinking about suicide, are you? What is that? Right? That's going to make the person feel like, oh, I better not say anything. This person is not comfortable here, right? And they're going to hear what we're showing them with our bodies more than they're going to hear what we're saying with our mouths, okay? And so it's important, again, that we cue into and be aware of those nonverbal cues, and how you asking is not important so much as their understanding that this is a trusting interchange between you and me where we're really communicating, and I'm comfortable with whatever you say, okay? And that's important that we convey that message, okay? Well, of course, also, what we do say is sometimes important if you would actually say something to the effect of, you wouldn't do something really stupid, would you? Right, okay, well, we certainly don't want to make people feel stupid when they're in this vulnerable place. So we do have to think about our language. Again, it's about tuning into ourselves and recognizing when we may be uncomfortable, right? But making sure that we can present ourselves as comfortable as possible to put the other person at ease. Okay, so when we come into step 2, this is the seeking more information and keeping safe, right? Okay, we want to seek a private area to talk. I cannot tell you how many times I have heard people having really private conversations, like in hallways with consumers or clients, or just right out in front of other people. And I've always been so sensitive to the privacy of that person and their experience. And so we want to make sure that we do that and say, hey, let's come over here and talk, or can you come into my office, or can we go sit out in the living room, right? And just get that person alone where you can create that space that's safe. So that's really important, to set that safety in that environment, right? Okay, and then establishing the relationship is such an important piece. Again, we're talking about our language, we're talking about our body posture, we're talking about having a safe environment where we can talk. You may not always be able to create all of these things, but as many of these things as you can put in place and make the person more comfortable when you're having this awkward and difficult conversation, okay? So again, always put yourself in their shoes, right? And trying to be thinking, how can I let this person know that I care about them? And that's the relationship that we're talking about, finding out what's important to them, okay? And the third thing here, comment on what you see and observe non-judgmentally. So really similar to what your example was when you asked the question. You said, I've noticed that you're sad. I saw you crying and I'm concerned. And so we're saying, I saw you crying. And it's that non-judgmental observation, of a behavior that everybody could have seen, and you're just bringing it out into the light. Okay, and that lets the person know, wow, this person's really cued into me, and this person cares about me. And that's important. Be curious about their perceived problem. So as you start to have this conversation, you don't want to then, they're starting to talk about things that make me uncomfortable, whatever that may be. You want to try to keep that open line of communication and show an interest in whatever they're talking about. I mean, for me personally, it could be sports, which I don't know a whole lot about, but I would be like, oh, that's so okay, and I would try to really find something in there that I could really connect with, again, so that it feels like a natural conversation and they understand that I care about them and I'm asking about things that are important to them. Okay. Number 5, seeking to find out if they are at immediate high risk of suicide. That's that suicidal zone that Merily has already spoken with us about. If we think, yes, this person, we've asked the question, now they're really starting to open up and they've let me know they actually have a plan. They have a plan. Do they have access to means? Yes, they do. Okay, I'm entering into a high-risk situation here. I need to take immediate steps, right, to keep this person safe and to make sure that those means are restricted. If they tell me I have lethal means in my purse, well, yeah, I don't want to leave them alone with that purse, right? Whether it's a gun or pills or whatever it is in there, I need to make sure that that person is safe and that I'm intervening in that situation. So I'm going to find out, number 6, who and where they would normally go to for help. Okay, and so this is starting to talk about some safety planning ideas. Family, friends, pastor, neighbor, who helps this person feel good about themselves? Who do they feel safe with? Who matters in their life? You want to find out who those people are and engage them in this process with you, if at all possible. Find out if they have a regular doctor. Do they already have a mental health professional that they're speaking to? Or maybe they have a youth counselor or pastor that they feel comfortable talking to. Find out who these people are that matter to them. And be sure to be aware of your own nonverbal and verbal interactions, just like we had already mentioned before. Okay, so that's all part of the seeking more information and keeping safe, right? So we're trying to learn about this person. We're trying to find out what makes them feel good, and who the people are that make them feel good, and trying to engage them in the process. And as you seek more information, help ensure the person's safety. One of the things we talk about, years ago, we were trained on doing no harm contracts. Some of you may have heard of those, or they may still be in existence in some areas. And we're really knowing now through research that those don't actually do anything to ensure that somebody does not take their own life. Okay? It's really more on the liability of the person who does it. It makes them feel better, but it doesn't really make the person receiving the contract feel any better. And so we're really now saying that that's not a best practice. So I just wanted to mention that in case some of you are still out there doing that or know people that are. Really what's best practice now is what's called a safety plan. And we have examples of those for you, and we can give you examples of those, and you should have them in your packets there. An example of a safety plan. And what it is it can be as simple as a note card with the things that we've been talking about, the places that they like to go that help them stay safe. I know that a good friend of mine who does this training a lot always talks about they like to go to Barnes & Noble because it's light and it's bright and it's a bookstore, and they can get a magazine, they can get a coffee, they can be around people, and it helps them to feel safe. Myself, I always feel better out in nature. I want to get out and take a walk, but maybe I'll grab a friend because I'm feeling down, okay? And so you want to know the places, and that would be the kind of thing that we could put in a safety plan. And it would be really more about that means restriction, making sure they don't have that purse with the lethal means in it, making sure that they have some places written down, that they feel safe to go, the numbers and names of the people that they care about, and that it's all easily accessible to them. And then engaging them in really coming up with things that they can do when they're upset that work for them. And so that's an example of safety planning. Of course, with immediate risk of suicide, we're in that high-risk situation. We're going to stay with that person at all times. We're not leaving that person alone at any point, and we are going to call 911 when we know it's in that high-risk situation. Okay? Get them to the nearest emergency room or emergency department or crisis center and accompany them. Go with them. Don't just leave them to go on their own. Okay. Step 3. You guys remember what step 3 is? Know how and where to refer. The third step in the referral process is to know nationally and in Texas and in your local area. So we have a lot of resources for you today in your handouts and your packets that you can look at. And we'll talk about some of the national resources, statewide resources, and then really it's incumbent upon you to know the resources in your local area and your local community, because those really vary from city and town. So we have rural areas that have very different resources, and then maybe more urban areas have a very different set of local resources. So at this point, I want to talk to you about the National Suicide Prevention Lifeline. That is the 1-800 number that we recommend that you call. And I often get the question, is it okay to call if you're calling for somebody else? And the answer is yes, it is. If you just don't know what to do when you find yourself in this situation, you can't remember anything from this training, call them and they will help you through this process, okay? And that is, we call it saving a number to save a life. And I actually ask you to now take out your cell phones, which we told you to turn off earlier. So take out your cell phones, and we are going to enter this number into your cell phones. You know, we're not in this age anymore of everybody having lists and phone numbers in their purses and their wallets and address lists. Really, everybody seems to save everything in their smartphones. So please put this number in there now. Okay, thank you. Wonderful. Now that we've done that, we can move on with talking about other places and references in Texas. Of course, as we've already mentioned, but it's worth mentioning again, do not be afraid to call 911. Okay, get somebody to a hospital or emergency department, because we really are talking about a life and death situation at this point. One thing that many people don't realize is that in Texas, in different areas, there is an opportunity to contact your mobile crisis outreach team. They're called MCOT teams. And that is made up of mental health professionals as well as law enforcement. And so you can call them, and at any time they will go out, and they're supposed to be deployed when somebody is at risk, come to you, and they can do a psychological evaluation and assess that person right at that moment and at that time and help you to help them get the help that they need. Okay, so that is something that we want to cue in on. We also have crisis lines throughout Texas. So we have the national number that you've all just saved, and then we also have local numbers. If you're in the area, you want to make sure that you have those local numbers and resources, again, before the crisis. Okay, you don't want to be scrambling looking for them when you find yourself in this situation. So we want to already have our phones armed with that information. Something to help you with that is an app that we have developed based on this very training that you can get free online on any smartphone. And I actually have it here on my phone. And it's called Ask About Suicide to Save a Life, which is the name of this training. And when you can Google that, or you can go to wherever you buy your apps and click on it here, and it'll come up, Ask About Suicide to Save a Life. And what it will do is it has all of the warning signs that we just went through, that Merily took us through, and it has how to ask, right, the question, which we've just been through. And then there's also a part in here about hotlines. And actually we have every county in Texas on this phone, and you can find out what the local crisis center and the local mental health authority is in your county. They're all here on the phone. And so I've been on the road doing trainings and had to stop and pull this out and click this, and it's a nice, easy way to access all the information. So that's something that you have at your fingertips if you'll take a moment and download that app. Okay. You can also go on to the Department of State Health Services website, which is listed here. And under the Reference Center, you can go to the TexasSuicidePrevention.org website that I believe Merily talked about earlier. And you can find all of the crisis centers. You can put in your zip code. You can look it up by county. There's a lot of ways that you can find this information online at these two websites. Okay. It's important that we don't just go online. If we want really good research-based information about suicide care, suicide prevention, suicide intervention, it's important to go to a credible resource site that has all of their information based on research, best practices. It's safe to stay with like government agencies who have to really test things before they just put them online. If you just go online and Google suicide, you're going to come up with all kinds of stuff. And if you're really wanting to educate yourself and have factual information and not get into these sites that glorify suicide and talk about the myths, I really recommend that you go to this list of resources, and you will find what you need there. And as Merily has already mentioned, you can always contact one of the two of us, and you have our contact information in this presentation. Okay, so let's remember and recap, right? What you've been saying all along. We're hoping that it's ingrained in your minds now. Can you say it with me one last time?
Ask about suicide. Seek more information and keep safe. Know how and where to refer.
Good. All right. I'm glad we all finally know that. Thank you. I do want to thank everyone for coming. I want to encourage you to download the app, use it as a follow-up tool for yourselves, take back these resource materials, try on the different types of things we talked about today, and implement these strategies. You can rest assured and be confident in your ability to intervene now, knowing that what you're doing is based on best practices. And I encourage and implore you to do that, because we really can save lives through these strategies. And that's what we're here to do today. And I thank you for coming. The last thing I want to talk to you about is an opportunity. We have several videos that are available on the websites that I just reviewed with you. At the Department of State Health Services website, also at the TexasSuicidePrevention.org website. We have several videos of youth and young adults seeking help and getting help for friends. We have one young man who's quite extraordinary. He actually went through this training, and he went home. Several weeks later, he had an opportunity where he had a friend in trouble, and he was actually able to do everything we talked about today and intervene and get that person help. And this is his story of how he did that.